Professional Development Avenue of the Rotaract Club of the Faculty of Medicine, University of Colombo. We extend a warm welcome to all Rotaractors and undergraduates who have joined us this evening, and we hope that the insights you gain today will enhance your student experience and make life in university just a little bit easier. As always, our aim is to equip you with the skill set that is crucial for academic success, while bridging the gap between teacher-centered school education and undergraduate learning, which is more student-centered. Insights you gain today. In our previous session, we had Professor Priyanjali D'Souza, who spoke to us about developing habits that empower us. And in the session before, we had Professor Saroj Jayasimha, who shared with us several valuable study techniques in his session titled Learn How to Learn. Today, we will be exploring a topic that has been requested by many of our participants, and it concerns a daunting part of our undergraduate lives that we both can and cannot do without. And if you haven't, exams are a bittersweet experience. Bitter when you fail and ever so sweet when you succeed. And here at the Undergrad, we want to ensure that you taste the sweetness of success at every examination. And what better person to talk to us about acing exams than someone who has already aced their undergraduate career. Our guest speaker today graduated from the Colombo Medical Faculty with first-class honors, achieving distinctions in 10 of 13 subjects and 20 medals, including the award for Student of the Year of the University of Colombo. This all-rounder emerged first in the order of merit among medical undergraduates in the year 1996 and was awarded University Colors for Rugby. He has been awarded several President's Awards for research, the Award of Research Excellence of the University of Colombo, and the Graduate Scholarship of St. Hugh's College of the University of Oxford. The eminent personality I have introduced to you is none other than Professor Tershi Chang, consultant neurologist and professor in neurology of the Department of Clinical Medicine of the University of Colombo. Our talk today will be followed by a Q&A session, and so we request our participants today to submit their questions directly to the host via the chat function. And now, without further ado, I invite Professor Chang to commence his masterclass on how to ace your exams. So over to you, sir.
Thank you very much. Thank you for that generous introduction. Let me at the outset thank the Rotaract of the Faculty of Medicine, Colombo, for inviting me to talk today. Right. The outline of my talk would be mainly fourfold to see basically how you would plan for an exam. How would you prepare for the exam? Now, when you say prepare, you cannot dissociate that with the effective study methods. So I will be touching on the study methods that would give you optimal results. And then the third segment of the lecture or the talk would be on how you practice certain exam strategies to optimize your outcome. And finally, the exam itself, how would you optimize your performance so that you score the highest grades that you deserve. Now, whilst doing all this, I will be giving you some important tips how to enhance long-term memory, tips how to approach different types of exams, and of course, the pitfalls that you need to avoid. Now, I'm going to give you insights as a student who went through the exams, and now from the other aspect of it as an examiner. So you get both sides of the coin. As a student and as an examiner, you'll get the insights as to the best method to approach an exam. Of course, my primary focus would be on the medical curriculum, that is what I am familiar with. However, I'm sure I would impart some generic skills that would be useful for any course of study within the undergraduate curriculum. Right. So let us start from the beginning. Why exams? Why do we need exams in the first place? It's a necessity. It is something that we cannot do without. And competencies of the candidate, of the student, to ensure that the student has successfully completed the course. So that is a necessary part of any study course. There are no study courses without exams. Now, how can exams be useful to students, to the candidates who undergo, to the undergraduates? It is a self-evaluation, because when you face an exam and you have a result, then you can basically evaluate yourself and know whether you are achieving the status that you want, whether you are where you are expected to be at a level of knowledge and competence. But more importantly, exams tell us what to learn. So it directs learning. As this quote here, the exam instructs students what to learn. If you look at the exams, then you know exactly this is how much I need to learn, and this is what I need to learn. And also, you see, we all work towards deadlines, and when there's an exam, it's a drive for us to take a step back, prepare for the exam. So it drives people to learn, to reach that exam. So the exams are important. Exams are important to assess you, as well as exams are a good guide to students as to knowing what to learn. Now, why study? What are the objectives of study? Can I get some feedback on a chat? Perhaps can you just write in a few objectives? Why study? It would be nice to have some interaction as we go along. You can send me in the chat. Why study? Are the students able to
yes, sir. The chat
write in the chat?
Yes, it's enabled. So the participants can put their answers on chat.
Okay, so we have a few things to understand concepts, to understand subject, to understand the curriculum, to memorize. Why study? Because that is the crux of getting to the exam, to gain knowledge and use it to the benefit of society. To apply, to explore. No one has really said the first thing, why people study. Why do you study in an undergraduate course or in any course? Yes, finally, to pass exams, right? Any other objectives? So there are many others to explore, to apply, to know the facts, to gain knowledge, to understand the subject. Okay, right. So now I commonly ask this question when students come for their professoriate. And the most common answer I get is to pass exams, because students in the final year are focused on the final exam, right? Okay. But is it good enough? I would say no, it is not good enough just to pass the exam. You must pass the exam to the best of your ability. That is the most important. Because anyone will pass the exam. Now, I'm talking to you like as an examiner now, not as a student, as an examiner. We make the exams. So to fail the exam is not easy. To fail an exam is not easy. If you're failing an exam, that means there is something really wrong, either in your study method or in your exam method. Okay. So at undergraduate level, it's a whole different story when it's postgraduate. But when it's undergraduate, we do our best to pass students. The default is to pass students. But students, keep fighting with us and they try to fail, but we try to pass. So as an examiner, yes, passing exams are not difficult. But what is difficult is to pass the exam to your best of your ability, right? Each one of you have a different potential, right? If someone has the potential to get a first class, a distinction, if you just pass, then that is useless. right? So your number one objective should be to pass the exam to the best of your ability, right? So if you are a first class person, if you're a distinction person, you need to get that. Otherwise, passing an exam for someone who should get a distinction is, as good as failing the exam, right? So that should be your number one objective. What is your number two objective? It is to acquire the knowledge, skills, and attitudes to be a competent intern medical officer. Now here, I'm relating it to the medical curriculum. But of course, if you're in another study course, say if you're doing science, then you can say to be a competent scientist, to be a competent architect, to be a competent teacher. Whatever your final profession is going to be, that is where you want to get to at the end of the course, right? So now if you look at these two objectives, they're not mutually exclusive. Meaning, if you aim for the second objective, the first objective is achieved automatically. So what I'm trying to tell you is, as an examiner, what we evaluate in students is the second objective. And if you can do the second objective very well, so to achieve the second objective is what we do in the first objective, right? So these two are one and the same. So if you aim to acquire knowledge, skills, and attitude to be a competent intern medical officer, then you automatically will pass the exam to the best of your abilities, because that is what we are testing. So our exams are all designed to test that. If it's designed to test that, then you have no problem. So you have to aim just for one objective. Okay. So with that in mind, let's look at the approach to exams. Now, there are many exams in our undergraduate curriculum, right? Now, when you plan for an exam, there is what I call a macro plan and a micro plan. Now, students, when they start the course, everybody is given a student handbook, but I doubt whether very many students even open the book or read the book. In that book, we give you the whole undergraduate curriculum. Now, that is important because you need to have a macro plan. Now, if you look at this cartoon here, where you want to get at the end of the course is here. The final product, the intern medical officer, the scientist, the architect, the entrepreneur. So what you want to get is the final end product. That is the bigger picture. That is the ultimate goal. Now, to get there, there are several hurdles. Now, if you look from the first hurdle, there are many exams. So you get over each of these obstacles to finally get where you want to be. So the micro plan is the steps within the macro plan. Now, what happens most often, students only focus on the exam immediately in front of them. They only see that exam. So when a student is entering the course, he looks at, he only is interested, he or she is interested only in the first exam. They are not bothered. So when you tell, there is, the final thing is you have to do clinicals. No, that is not for me now. I only have to do the papers and the OSCEs and the spots. That's all I need to do, right? That is fine. But, that kind of defeats your approach to reaching where you want to be, because the most important exam after you doing your A-levels is the final exam, because it is the final exam that determines where you will be in your career. Now, in undergraduate career in medicine, it is the final exam that determines your merit list, determines where you are on that merit list. Similarly, if you are doing any other profession, it is the final exam that gives you a class and give you a job opportunity. So if you have the bigger picture in your mind, like I said, the two objectives is to pass the exam to the best of one's ability. But if you're passing to achieve the knowledge, skills, and attitude to be a competent end product, that will be, which I have circled here. So with this bigger picture in mind, you're likely to, when you're approaching the smaller goals, the smaller hurdles side, you're likely to be more successful at the small exam, because each one of these exams are designed to get you to the final product. So you may not see it at the initial thing. A very basic thing that we test there is always linked to the final product. Because in our curriculum, now again, I'm talking to you as an examiner, as an academic, we align our teaching. So although we are segregated artificially as the basic sciences and the clinical sciences, we actually work together because we talk to each other and say, this is what we want you all to teach the students at basic sciences or in the community stream or in the behavioral sciences stream. Because in the final year, this is what we want. And there is often a dialogue, a communication to ensure that the final product is a culmination, a collection of all these knowledge and skills and attitudes that you gain. So each one of these little exams are important towards this final exam. So you need to have your sight on the main end product as you're approaching the smaller exams within the course. Now let's look at the medical curriculum and see your macro plan. And why is it important to know this? Now, if you look here you have the years. So the course is 5 years. In the first year, the student enters the basic sciences and starts the community stream and the humanities, society and professional stream, previously known as the behavioral sciences stream. Then you have the applied sciences stream, the many modules, about 17 modules. And now with the A-level 2018 batch, we have introduced the clinical sciences stream modules. And the clinical rotation would start from the second year onwards, not in a big way, but gradually by the fourth and in the fifth year, where you do the professorals, it's all clinicals, right? Clinical rotation. So you can see that all these things that you learned before, the basic sciences, applied sciences, community stream, humanities, society, professionalism, all these have to be integrated into the final clinical sciences stream. So the clinical sciences stream is the ultimate integration. So initially you are learning stuff. And if you look at the bottom here, I have memorization. Now some said you need to memorize content. But as you can see, as you go through the course, you shift from memorization to application. Now, this shift is so important. This is the most important thing in succeeding in exams, to appreciate that. I'm sure it is true for every discipline that you do, not only for medicine. And in medicine, it is extremely so. You need to shift because as you enter the course, it's about, in basic sciences, in applied science, in all these streams, there is a huge content to memorize. There's a huge content of knowledge, a chunk of knowledge that you need to develop, acquire, retain, and retrieve. As you go along, you need to develop skills where you apply that knowledge. So there's a shift from memorization to application. And within each stream, that is also this within each stream, even in the applied sciences stream, community stream, this happens. And that is why, unlike when we were undergraduates, where the clinicals came later in the course, here the clinicals are early in the course. By about the second year, you are introduced to clinicals. That is to get you to apply knowledge into the clinical courses, right? So now, why is it so important to know this? Because what we have seen over generations are students who have been very good at the advanced level, got A's, 3 A's, and have been very high EZ scores. They do not do very well when it comes to the medical curriculum. And that is because they still retain their A-level techniques. Now, A-level technique is largely memorization, hardly any application. The only application you have in the bioscience is physics. Everything else is just memorization. So if you're memorizing, and that is the only, you think that is, the thing is, some students don't want to give up that strategy because that has given them dividends, have given them success to get into university. So they think that is the right method. So if you use the strategy of memorization, whereas when we are testing, in the finals, we test application. So you are completely lost. So Generation after generation, we have seen students who have been extremely good in the A-levels have not done so well when it comes to the medical, because they have failed to shift from. That is a skill. More than a knowledge, it's a skill. Application is a skill. And skills come only with practice. So that is why there is exposure to clinicals very early in the course. And it is the student who shifts from memorization to application, who masters the skill, does well in the exams. So that is the number one thing about getting high grades at exams, is to shift your strategy from memorization to application. So let me tell you how to do that as we go along. So with that basic concept, let's move. Before we move, there is also a pitfall. Now, there are multiple exams in every curriculum, and particularly so in the medicine curriculum. Now, you can, like I told you, the undergraduate curriculum, our default is to pass students. We push students, we pass students, we make exams lenient. Our default is to pass students. And it's very easy to pass. So if you want to pass an exam, say a module exam, there are students who just prepare for the exam a week before. There are students who prepare just 2 days before. What they do is last minute memorizing answers and questions. And because, often these module exams, you will have these similar questions appearing. And it is not unusual for a student to pass. But nonetheless, you will stumble at the macro level. Macro level, what I say by ESA is the end of stream assessment. Because the macro level, as I told you before, it is about application. So when you come to the main exam, you're going to stumble. Also, where you memorize just for a week or so, that doesn't go into the long-term memory. So it doesn't benefit you. If you're doing exams where you just cram the last minute, pass the exam, you have not understood or appreciated the goal of the whole course. Because the whole course is one course. Everything that you learn has to be finally applied at the finals. So it's a build-up. It's a spiral. We start small, we gradually spiral up because there is capacity level. So this is a pitfall that you need to understand. Here you will have multiple exams in each of these streams. And if you think, yeah, I'm just going to memorize that, close the book, forget about that, and then come to your finals, which is just 1 year. That 1 year actually encompasses everything that you did in the previous 4 years. So if you're forgotten everything there and you think I'm going to learn everything in the final year, you're not going to do well. So that is the first principle and a pitfall to avoid. Okay, this is best exemplified by this quote that I would like to share with you. Let me read it. To study the phenomenon of disease without books is to sail an uncharted sea. To study books without patience is not to go to sea at all. This is a quote by Sir William Osler, who is considered the father of modern medicine. He was the professor of medicine in Oxford in the 1800s. Now, what does that mean? Say, we want to go to Australia by boat. So what we do is, we jump into the sea with a boat, a good yacht, to go to Australia. But we have no maps. Do you think we'll get to Australia? We won't. We'll be lost at sea. Then we think, no, that is not the way. We need to study the maps. So we study the maps and we can tell anyone how to get to Australia, the best sea route. But we have never sailed in our life. So we take the maps and jump into a yacht. You think we will ever get to Australia? We won't. Because we do not know how to sail. So that is like to study books without patience. It's not to go to sea at all. So this quote encompasses several meanings. Just what I have told you so far. Knowledge is only useful if you know how to use it. And it is a skill. So unless you have practiced using that knowledge, you're not going to use that knowledge in an exam situation, which is a very stressful situation. So if you have practiced it again and again and again, where you applied the knowledge to a clinical situation, then you're going to do well in that situation. Right. So this little cartoon or picture basically shows you what it is. there is a bridge that you need to build between theory and practice. And how well you build that bridge, how well you cross that bridge, is what we assess by exam. So if you know what the exam is evaluating and you prepare this, I told you, is the outline of my exam, of my lecture. So it's going to be plan, prepare, practice, and perform, right? So now I'm going to focus on the smaller exams. Now I've given you the bigger picture. Don't lose sight of the bigger picture. But each assessment, how are we going to plan, prepare, practice, and perform? I'm going to give you some tips that are going to help you with your exams. And at the end of this talk, once I go through these 4 components or segments, I'm going to give you an approach to each of the different types of exams. So let's look at planning. Allow yourself adequate time for preparation. So don't wait till the last week or the last few days to prepare for the exam. So you must go and look at the schedule, the exam schedule, give yourself enough time. Then you need to identify what are the components of the exam that you have to face at the end of your module. Is it an MCQ exam? Is it an SCQ? OSCE or OSPE? Is it a dissertation or report that you need to submit? Is it a viva voce or are there clinicals? You then need to identify the requisite content for the above components. Say if you have MCQs, you are going to look at the past MCQ papers and SCQ papers. So you're going to collect all that, look at the areas that needs to be covered. Now, as an examiner, now I'm talking again with the examiner's hat. What we do is we blueprint. What do you mean by blueprint? If we have taught you something within that module, we try to make sure that everything is sampled into the final assessment, particularly core areas, so that when you have an MCQ paper, that it covers all the topics that have been taught to you. So that is a blueprint. And if it's not in the MCQ, it will be in the SCQ. If it's not in the MCQ, SCQ, it will be in the OSCE. So we make sure that some component of the exam will reflect what you have learned. Okay. So when you go through the past questions, you can see that. And when you see that, you know how much you need to prepare. You know the content that you need to prepare. So once you have your MCQs, SCQ papers collected, then you know the time duration you have. Say you have 4 weeks. Then you divide the time. How much time am I going to do for the MCQ? So how many MCQ papers do I need to do? Say you have 4 weeks, you have 20 MCQ papers, right? So if you have 4 weeks and 20 MCQ papers, that means you need to do 5 MCQ papers per week. So that is how you plan your time. Of course, you have MCQs, SCQs, and OSCEs. You're not going to give equal time to each of those components. It all depends on the amount or the content that you need to do. Because SCQs, it may be 2 SCQs, whereas it may be 30 or 40 MCQs that you need to prepare. So which means you need to give more time for the MCQ than you would allocate for the SCQ, right? So it depends on the exam component. So first and foremost, identify the exam components, identify the content, look at the past questions, how much you need to read, how much theory you need to study for, and then plan your time. So you timetable your time. If you have 4 weeks, how much time you spend for MCQs, SCQs, and studying theory to achieve that. So that you have a very clear plan before the exam. The second segment is on preparation. Now, preparation, you cannot dissociate or divorce from effective study methods. Effective study methods that will give you optimal results. So let's look at that. Now, this is the most important thing. Find your own style. You cannot copy someone else's style. There's no point in going to your batch and finding the person who's doing the exam best and asking him what is the way you study and try to replicate that. Of course, it's good to ask people who are successful, how do they study, and take what suits you. But each student is unique. Each one has a different way of studying. For example, look at the time. Some people are morning people, some people are night people. And it can change from time to time. When I started the medical curriculum as an undergraduate, I was a morning person. I used to wake up, 4 o'clock in the morning to study. As time went by, I realized I was more a night person. So I stopped waking up in the morning. I started studying late into the night. So it depends what time. You cannot do what someone else is doing. It has to be your own style. Where do you study? Some people study in their room. Some people study in common areas. Some people study in libraries. So it all depends on what suits you. Then do you study alone or do you study in groups? Again, it depends what is most effective to you. But of course, there is one little tip. Now, for multiple choice question, it is not cost effective to study alone, because when you have to find answers to questions, if you have to do it alone, it takes a lot of time. Whereas if you have a group of students where you're looking for the answers, it's much quicker. So if you're doing exam questions, it's good to do it as a group. Then some people study by reciting. Some people study by teaching someone else. That's an excellent way of doing it, because if you can explain a concept to someone else, that means you have understood it. Some people are very visual. They need to have pictures. They need to have videos. They need to have diagrams. So the most important thing is, the most important thing in having an effective method is to find your own style. Someone else's style will not suit you. Very important. Spaced repetition. Now, there is this tendency for us to, when we sit, we want to study 2-3 hours and finish that whole section. That really is not very effective. It's always good to take little breaks in between. Give your brain a little bit of a rest in between. Give your eyes a little bit of rest in between. Focus on a distant object so that your ocular muscle relax. And it is more effective to take little chunks in at a time rather than going at a stretch. Now, when you study, say you take a lesson and you want to study that, you want to complete that area. So you say, in 2 hours, I will complete this. And then at the end of it, you feel happy. Yes, now I am wiser. I have learned so much. I know everything about this topic. But does that help you at an exam? It may not, because you may retain knowledge, but you may not retrieve it that is useful for an exam. So if you want to retrieve it to be useful for an exam, as you're studying, you need to self-test. That means when you study something, at the end of it, you either have to generate questions that you think may be asked at the exam, or more useful would be to get the past papers or the past questions, and immediately after the area of study, to look at those questions and see whether you can answer those questions. Because then it is not only retaining knowledge, you also learn how to retrieve what is useful for the exam. And that is a strategy, important exam strategy that you need to do when you're studying. So just study, yes, you need to study to understand concepts, to acquire knowledge, to retain knowledge. But at the same time, you also need to be able to retrieve that knowledge to apply it for the exam situation. So no better way than asking yourself questions, generating questions and answers, and also looking at the past questions and see whether, now that you have acquired the knowledge, whether you can answer the questions. Now, sleeping at night is very, very important, because it is in our sleep. And now I'm talking to you as a neuroscientist. Because it is during our sleep that we form memories. So even if you have studied a lot, that memory is only going to be short-lived if you don't have adequate sleep. When I say adequate sleep, it depends on each individual. Some people need 8 hours sleep. Some people are good with 6 hours sleep. So again, it's your own style, your own way. So if it's 6 hours that you usually sleep, that's fine. But have that. So if someone is sleeping, is used to 6 hours sleep, and if you're sleeping 4 hours, then you're not going to form any memories. Okay, so whatever you study will be short-lived. So if you want it to be long-lasting, have adequate sleep. Now, how can you sleep? You can sleep only if you manage your time properly. So time management is the most crucial thing. I see students wasting time. Now, again, I'm talking as an academic because I remember when I go to the wards, I don't, sit and chat. There's a time and place for that. I spend a lot of time in the canteen. I spend a lot of time in the common room. That is to sit and chat. But when I'm in the wards, it's about, seeing patients. If I finish seeing my patient, then I go to the emergency trolley and look at the medication. Look at the different procedures, right? You must optimize your time. If you're somewhere, optimize your time. I've seen students who loiter around waiting for someone to come and teach them something. You are adult learners. So you should be capable of learning by yourself. You don't need someone to come and give you a lesson. That is the A-level strategy, where you're so used to tuition classes. You go to a class and you wait for the master to tell you something and then you write it down. That is an A-level mentality. So you need to move away. I told you, in that whole curriculum, you need to shift from a memorizing sort of A-level mentality to an undergraduate university learning, which is self-learning. So if you're in that situation, if you're given the opportunity, learning material are your patients, the ward, the procedure. So get around, observe, listen, go through the tickets, see what's happening to patients, you learn a lot. So time management is important. So when you manage your time, so if every moment you're learning, then you are not pressed to, come and study what you should be learning in the ward. You don't have to come to the room and study. So it's like going to the sea and studying the books. When you're in the ward, you study the patients. When you're in the room, you study the books. Now, I also see students coming to the ward, they're seated in the ward and they're studying the books. Right? So that's completely, incongruous. It's like going to the library, right, and studying a cardiac murmur. I can guarantee you, however much you keep a state on the book, you're not going to hear the murmur. You can read about it, but you can keep the state on the book, you're not going to hear the murmur. So you need to, when you're in the ward, you can look at the patient's precodium, you won't be reading anything about the murmur. So you must know where and what you're doing. And use time with precision, use time as premium. So when you do that, you'll have enough time to sleep. Because what happens is students waste a lot of time either scrolling on the phone, on social media, and then they want to study everything that they have to do in the ward, they study in the library, which is ineffective to start off with. And then you waste a lot of time because you don't have time. Then what happens is that you are unable to sleep because then you have to keep awake to do all the stuff you should have been doing during the day. So time management is crucial. Right. Now, this is an important topic. Tips to enhance long-term memory. Now, there are 3 strategies that we use in study and learning, right? So there are 3 types of learners. One is the superficial learner, next is the deep learner, and the third type is the strategic learner. Now, who is a superficial learner? Superficial learner is someone who memorizes list. So let me give you a medical example. Patient comes with a heart attack or acute coronary syndrome. So initially, we learn that the medical treatment, the initial immediate treatment, you will give dual antiplatelet treatment. You give aspirin, you give clopidogrel, you give a statin, you give a blood pressure medication, and you give the heparin. So that we memorize that. So every student will know that. So if you ask the student, what do you treat? How do you treat acute coronary syndrome? They will just list it out. So that's the superficial learner. But if you ask the superficial learner, why do you give aspirin to a patient with acute coronary syndrome or a heart attack? He won't know. If you ask him what is the mechanism of aspirin in preventing or treating acute coronary syndrome, he won't know. Because he has only memorized that. It's not gone beneath the surface. Whereas the deep learner, he will learn this, he will memorize this, but then ask why. Why do you give clopidogrel? How does clopidogrel act? How does clopidogrel improve the survival of a patient who has a heart attack or acute coronary syndrome? Why do we give statins? Why do we give a large dose of statins? And how does statin act to reduce the mortality and improve the survival of a patient who has a heart attack or acute coronary syndrome? So that's the deep learning. Now, when you go into deep learning, you can go, there is no limit to it. You can go even to the structure of the S3 molecule and try to figure out how many carbon atoms it has and how many nitrogen atoms it has. But that knowledge is useless because no one will ask you that. So that is where you get the strategic learner. Who is the strategic learner? Strategic learner is a deep learner who knows what that person needs to know at that level. Meaning, what do you need to know as an undergraduate? That is a strategic learner. So the strategic learner knows, I need to do deep learning, but this is all I need to know as an undergraduate. Beyond this is useless knowledge or postgraduate knowledge that will never be tested from me. So that the strategic learner has enough time and knows how much to learn deep. So superficial learning is not good enough. Deep learning is essential, but don't get lost in deep learning because you can get lost. There is no end to it because the syllabus is so vast. So you need to know how much do I need to know as an undergraduate. So how do you figure out? How do you know how much do I need to know as an undergraduate? It's by keeping your eyes and ears open during the ward round. Because in the ward round, you can hear doctors, the consultants discussing with the registrars, the house officers, and so on. You also will figure this out by the questions that it's been asked of you during the ward round. You will also figure this out during your assessment at different levels, right? So when you have MCQs, SCQs, there are certain areas that keep tested again and again because these are core areas. So then you are a strategic learner, you know how far you need to go in depth of a subject. So important, be a strategic learner, don't be a superficial learner or a deep learner. You can use mnemonics. Mnemonics, there's another slide. I will tell you what mnemonics are. Use mnemonics effectively. Chunk and store information. That's a strategy we use to store information that we can retain and retrieve. Now, what do you mean by chunky? Now, those who have done the neurology module with me will know about how I use classifications. I always say classification should be simple and pragmatic. Simple so that you can remember it, pragmatic that you can apply it to the patient in front of you or the situation that you are faced with. Okay. So when you classify things, now for example, if I am to learn all the causes of a neuropathy and I, memorize the list, I'm likely to forget it. In a few days, weeks, I'm likely to forget. But if I classify it, now I say, okay, new causes of neuropathy. There are inherited causes, there are acquired causes. Under the acquired causes, there are toxins like alcohol. There are endocrine causes. One classification, endocrine causes like diabetes mellitus. There are metabolic causes like uremia. There are inflammatory causes like rheumatoid arthritis. There are autoimmune causes like SLE. There are infectious causes like leprosy. So if I classify into large groups, I'm more likely to remember it rather than whole list because you're likely to forget those lists. So chunk and store, I will show you another way, a slide on that in enhancing your long-term memory. Learning context. If you're learning in isolation, you're likely to forget it. Now let's take the example of the COVID virus. Now, if you look at the SARS-CoV-2 virus, and if you're supposed to learn the structure of the virus, you'll be learning about the spike protein and so on. So you just need to memorize this. But if you just memorize it, you are going to forget it in just a few minutes. Not few minutes, in a few days, in a few days. But if you learn it in context, now if you think, okay, the spike protein is what the COVID virus used to go and bind the ACE2 receptor, the angiotensin converting enzyme to receptor. And the spike protein is what we use in vaccines to mRNA vaccines to develop antibodies against the spike protein. So it prevents the spike protein from binding the ACE2 receptor that will cause the disease, because it's through the receptor that the virus gets into the cell. So if you learn it in context, then you know the importance of learning that structure. But if you just memorize the structure, you're bound to forget it. Now, this is the important thing. Make your own notes or diagrams. Now, in this day and age, it's a bit difficult because people now are all digital. So what most students do is that they copy and paste or they download. And when you do that, or you borrow someone else's notes, that really doesn't work. What research has shown is that when you write down something with your hand, you're more likely to retain that because you need to understand, then you put it into an action of writing. So it's going through your gray cells, your circuits that will retain that information. Whereas if you just look at, downloaded articles or someone else's notes, it's not going to retain that long. So I would advise that if you're downloading someone else's note, on that you write down your own notes, right? If you're writing your own notes, that's well and good. That's fantastic. That is what we did. We used a pen and paper and wrote everything down. But this day and age, everybody's using tabs and you're using, technology. If you're doing that, make sure that you make your notes on top of whatever notes you're using, so that you retain more rather than just trying to read someone else's note. And it is not your words, because if you're reading something and you're writing a note, you're writing it in your own words. Memorizing someone else's words doesn't work. You can't remember that. You can remember your own words. So write your own words, draw your own diagrams. That way you will remember longer and better. Then highlight text intelligently. So if you're using a note and you're highlighting it, highlight only the areas that you think are core, things that have been tested in exams and things that you do not know. So do not highlight the whole book. I see some students who highlights the whole page. So what's the point in highlighting? You highlight only the ones that you do not know or the ones that you think is very important, right? Once you study, you know it. So then it's very sparing that you need to highlight, right? So you highlight what is important, the core areas. Now, making your own notes and highlighting intelligently is very important. Why? Because it allows you to revise fast, what I call speed revise. So you don't have to read the whole note. When you open the lesson, that area you should be able to basically bring out, go through everything very fast by just going through the highlighted text or your little notes. So I, of course, made short notes, what we call short notes. From a big note, I made a little prompt area so that I could recite the answer when I generate a question on that topic. So that is called speed revise. And important to boost confidence. Now, the thing is, that is the donut theory. Now, when students study, they will study 80% of content. They are unable to study 20% because of lack of time. But they focus on what they have not studied. So that would impair your confidence. So when you are studying, always boost your confidence. Say, I have studied the core areas. Feel good about it. So the more confident you are, the more likely you will retrieve information rather than just studying and feeling, I have missed out. I could not study this area. Don't worry about that, because you see, even if you have studied 80% of the areas and you run out of time, if you are actually a strategic learner, you have actually studied the most important areas. And often the 20% you did not study will not be tested because you are a strategic learner. So that is why I started out saying you need to be a strategic learner, knowing exactly what the exam will be testing. And if you have done that deep learning, then always tell yourself, I have studied, I know it, and I shall do very well at the exam. That confidence is very important to retrieve information. Because if you go with a low level of confidence, then you don't retrieve, you are unable to retrieve the information you all actually have. So have confidence. It is like, Muhammad Ali, the greatest boxer. When he goes to the ring, he says, I'm the greatest. I shall win today. That's what you do. So when you go for an exam, say, I'm going to win today because I have prepared. Of course, you can't do that if you haven't prepared. If you haven't studied, you can't say, I'm the greatest, I'm going to win today, right? And then there's this technique of revising at spaced intervals. Now, if you study something today, revise it in 1 day. Revise that same thing in 1 week. Do speed revision and do the speed revision again in 1 month. When you do 1 day, 1 week, 1 month, you retain it much longer. Right. So this is an example of what I said was a mnemonic. These are, this is a memory device. When you use this as a device, now, for example, spikes protocol in breaking sensitive news. So S is for the setting, P is for the perception, I is for the invitation, K is for knowledge, E is for emotions and empathic response, and S is for strategy and summary. And it basically explains what each one of those are. So if you remember the spikes, then you know the steps that you need to go through when you're breaking sensitive news to a patient. So that is a mnemonic. Spikes is a mnemonic. So it's a mental device that we use to help us to retain and retrieve information. So there are different types of mnemonics people use, right? Okay, about chunking, there is a little video which will run for about 2 to 3 minutes.
081127882 is a hard number to remember. If you chunk the number into 081127882, it's easier. Cutting large bits of information into smaller pieces helps us to understand. If we put small pieces back together, we can see the big picture, and that helps us to remember. The process is called chunking. This is how it works. Our short-term memory is fast but tiny. According to learning expert Dr. Oakley, it can hold only 4 chunks of information at once. So when new inputs arrive, it has 2 ways to pick them up. First, it can overwrite and forget what it has to make space for new information. Or it can use mental effort to move a chunk from the working memory into the long-term memory, where it can be stored and remembered later. This is why it's almost impossible to recall 9 digits like 081127882. There is simply not enough space. Once chunked, there is. There are several ways to chunk. You can break a larger piece into smaller bits, identify patterns, or group pieces to see the larger picture. Once a chunk is created, you can use deliberate practice to move it into your long-term memory where it connects with existing experiences. Now it can be stored for years and, if regularly used, accessed without much mental effort. To make this transfer more effective, it helps to add context, which acts like memory superglue. Great instructors always try to give you the big picture before going into detail. If you study by yourself, you can skim through your textbook first by reading chapter headlines. Learning facts without understanding the big picture is pretty useless, as we will forget what we have learned very fast. Professional piano teachers first show their students the entire song so they understand the mood. Then they ask their students to practice one measure at a time. Once the part has been learned and the neural connections in the brain have been built, then students go on to the next measure. After all chunks can be played separately, they are combined until the entire piece is connected. Now the student can play the piece with less mental effort. Chunking also helps to understand complex topics, say trade between China and India. First, study China, the people, the culture, and the economy. Then summarize and put what you learned in your own simple language. Repeat the process for India. Then study trade itself, the mechanics, benefits, and problems. Again, simplify to form an underlying idea. At the end, you might just have summarized several books onto one napkin. Try chunking next time you feel the limits of your working memory. Just like how clever restaurants chunk their menus into starters, mains, and desserts with 3 to 4 options each. With chunking, it's easy to compare our options and make a decision. If you like our videos, 08.
Right. So now we come to our third segment, which is practice, how you practice exam strategies. First and foremost is study the exam format. You must know what is being tested. How you formulate strategies for each of the format, because the strategy for MCQ is different to a strategy to a SCQ. And then you need to test and perfect the strategy. You need to practice tests under simulated exam conditions. Sometimes you look at the SCQ and say, I know the answer for this, I'm fine. But in reality, when you have to do it under the situation, it's not easy. Now, for example, if you have SCQ of about 5 to 6 SCQs in a paper going over 3 hours, if you have not done that over 3 hours writing, first and foremost is, can you write for 3 hours in one go? Can you concentrate for 3 hours? So unless you do it under a simulated condition, under time conditions, it's very important to do it under time conditions. So if you are doing MCQs, do it under time conditions so that you simulate the real thing, right? You can finish it sooner, but you get an idea how fast or slow you are, how capable you are to concentrate for the given time, how capable you are to write physically. It's not easy because people have forgotten how to write. Do past papers. It's very important to get past paper at least for the last 5 years. So when you do past papers, right? So you do past papers in the last 5 years or 10 years. You don't need to do more than that because things outdate. And from these past papers, you are able to recognize patterns and co-areas, because when you go through these past papers, you will realize that the same questions, the same areas are being asked again and again, because then you realize that's a co-area. For example, you will see the question of dengue management. Almost every year, there is a question about dengue management. Or every 3 years, there's a question on leptospirosis. Okay. And every 3 or 4 years, there's a question about stroke management. So you recognize certain patterns, you recognize co-areas, because that then tells you exactly what you need to study. It also tells you what are your deficient areas. If those are your deficient areas and those are the areas that are being tested, an intelligent student will go back and strengthen those weak areas. So it's important to look at the past questions over the 5-10 years. And then as you get good at it, at recognizing patterns and co-areas, you will be even able to predict possible questions. So sometimes you may not be able to predict exactly the 5 SCQs you're going to get in the next exam, but at least you will have a pool of about 10 to 15 SCQs from which you think a question will come and you can prepare for those SCQs. So it is important to look at the past papers and be tuned with current trends. Now, we are in a pandemic. There is COVID going around. So it would be silly not to prepare for a question in COVID, because you know the question, there will be a question in COVID. There is an endemic or epidemic of dengue fever occurring. So if you don't prepare for dengue, then you wonder, are they not going to ask us this time? Because those are the current trends. So you have to have your eyes and ears open and see what's going on in the health sector. Right, finally we come to the last segment, which is what will bring on the best performance in you. Performance is based on preparation. That's what I've been telling you all this time. Now, if someone, who has done well, excelled at exams, told you, well, I got such good results without actually studying, that is a lie, because that is never the truth. I can tell you I studied really hard to get whatever I got, right? So input equals output. It's only a liar who will tell you that I did not work for my performance. So you have to work hard, right? So it's input that equals output. But of course, that input has to be strategic. So that is what I went through in this previous slides, telling you what are the best strategies in getting the maximum of what you put in. Confidence boosts performance. Now, your confidence comes with preparation. So if you are prepared well, then your confidence comes. Like I told you before, even if you are prepared 80%, if you are a strategic learner, you must build your confidence. Keep telling yourself, I'm good. I have done very well. So if you keep boosting your confidence, then your ability to retain knowledge is very much better. have adequate sleep at night. The worst thing you could ever do is to not sleep the day before the exam. That defeats everything that you have done in the last so many years. In your undergraduate curriculum, you spent years and years studying, and the day before the exam, you are stressed and thinking, I must cover this area, and you hardly sleep. I guarantee you are going to perform poorly, right? Because sleep before the day, rest before the day is so, so important. Don't ever not sleep the day before, right? Avoid being rushed. Very important. Get to the exam venue with time. Because if you're rushed, your adrenaline is pumping and your performance is all going to be interrupted because you're going to be so stressed in getting to the exam hall in time. And then once you get there, you're panting and you're tired and you're anxious and you're really going to perform poorly. So get to the exam hall in time. Don't feel rushed. Now, I often see students on the day of the exam, they are there at the exam hall still studying. They open their notes, they open their books, they open their tabs. And to me, that is a student who has not prepared. A student who has studied does not need to come in the morning, sit there and read the book. I have never done that because when I came to the exam, I had already done what I had to do. I had not done 100% all the time. Like I said, sometimes it's just 80%. But, I'm happy, I'm confident. I know I'm going to do this exam the best I can. Coming to the exam hall and reading a book or reading the notes or your phone or your tab just shows that you haven't prepared. You haven't planned it. You haven't prepared. You are now struggling and stressed in the last minute. Relax before the exam. That is the most important. Right. So I have covered the 4 segments that I intended to do: plan, then prepare, practice, and perform. Let me end with some assessment-specific approaches. So I'm just going to go through each assessment type and some tips for you to face these exams with success. So let's look at the MCQs. There are 2 types of MCQs, the true-false type and the single best answer MCQ. Now, when you get a true-false type MCQ, you will go on the first round and mark what you definitely know. So that's easy. Either you know or you don't know. If you know it, you just mark it. Then you leave out the ones that you're not sure. Then you go on a second round where you have to work out the answer. So with a little bit of memory prodding, you retrieve the information you already have and you can work out the answers on the second round. Then the third round is where you are shortlisted certain answers. So you have, kind of excluded certain. So from 5, true or false, you have, this is more likely to be true. And then you make an educated guess if you're feeling confident. That is the third round. So basically, I don't think you should ever go beyond third round. But the question is, how many rounds should you go? 1, 2, or 3? So students ask, how many MCQs should be marked? Now, why are these questions? Because in the true-false type, you get negative marks. So if you get a wrong answer, you get a negative mark. But for you, you're fortunate, it doesn't carry forward. So the negative marks is confined to that MCQ alone. When we were students, the marks carried over. So if you had -5 in one question, the next question, if you have +5, you get 0, right? But now it is only confined to that MCQ only. But nonetheless, you get negative marks. So you must know the ones you have to be quite confident to get it correct. So the question is, how many do I mark? That depends on where you are in the universe. So you must know from previous exams, previous performance, whether you are in the top 10 or in the middle 10 or in the below 10. So depending on that, you will determine how many you will mark, whether you will do only 1 round, whether you will do 2 rounds, or whether you will be bold enough to go for the 3rd round, right? So that depends on your previous performance. Are you good at guessing? Because the guessing has to be educated guesses. You can't do tactic, that's useless. Right. Then the single best answer response questions. There is usually a clinical scenario or vignette, and then you have a leading question. Thereafter, you have the 5 options to select from. You select one answer. So you have the clinical scenario, you have the leading question. What is the diagnosis? Then you have the 5 options, right? You should do what is called the cover test, meaning you cover the options with your hand. You only read the question and the scenario and the question. And with that scenario and question, usually you should know the answer. So when you open the options, the answer will be staring at you. Okay. Now in single best answers, there are no negatives. So please attempt all, do not let it go. SCQs, when you say SCQ, structured means there is a specific answer. So don't think that writing something I know and everything I know that I will get answers. Actually, it's the contrary. When you write things, you're wasting time. And if you're using up important and crucial time for your exam, writing things that you will score nothing, no marks for, because structured questions have structured answers and you will get marks only for those answers. It's very important to organize the answer. So be focused. First, spend time trying to figure out what the question is exactly asking. Be very focused, organize your answer, but be adequately elaborate. Don't assume that the examiner knows what you have in your mind. So be very clear. There should be a flow to your answer, right? Please pay attention to spellings, grammar, handwriting, and clarity, because these things are important. It reflects your personality. It reflects how well you have prepared. After all, it's a 5-year course. You have spent 5 years. The course is in English. And in that 5 years, if you cannot, spell, especially technical terms, it's not difficult to look at a book, look at the Google internet, if you're not sure of a word, and to copy that word down. If you can't do that after 5 years, that only reflects poor preparation. So you are not going to get good marks for that. Even if your answers are correct, you are not going to get full marks for SCQs with poor spellings, grammar, and handwriting, especially technical terms if you're not spelling it properly. Answer the easy questions first. When you get a SCQ paper, select the questions that you know. What you mean by easy are the questions you know. What is easy for one student may not be easy for another student, but it is just that what your level of knowledge is and what you know, you answer that first. Marks allocated to each component will give you a guide to how much time you want to spend on each component, because say the question, you have 30 minutes for a SCQ. And if one answer you are getting 10 marks, the other answer is getting 20 marks, obviously you have to spend more time with the one with 20 marks. And that tells you the extent of the answer that is expected. Then there's no wisdom in exceeding the time. Now, if you have 30 minutes for one question and say you have answered 80% of that question, you have already got 80% of the marks. There is a last segment where that gives you 20 marks, right? You know the answer very well to that question, but there's no point if you exceeded 30 minutes, no point spending time on that 20 mark component. It's better to move to the next question, which you do not know much about, but there are 100 marks for the taking. So even if you do not know much about it, if you write a, half-baked question, you still get 50 marks there. Rather than the 20 marks, you know very well. And you spend half an hour trying to write that 20-mark component. So if you have finished your time for that SCQ, if you have finished the 30 minutes, get on to the next SCQ. There's no wisdom in spending more time, even though you know the answer very well. Right, then we have the OSCE and the OSPE. OSCE is Objective Structured Clinical Examination. OSPE is Objective Structured Practical Examination. Now you must know what is being tested in OSCE or OSPE. What is being tested is the skill of practical application. It is not knowledge, it is about practical application. So that is what you have to prepare for. Visual recognition, you might be given an instrument and asked, what is this? How do you use this? Right? You may be given a picture and asked to, or a snake, to recognize a snake, a dead snake, right? So that is visual recognition. Then you may be given certain investigations, or pictures or videos of physical science, data of patients' investigations, results for you to interpret. Reading investigation, you may be given a CT scan, an MRI scan to read, or a ECG. Then there are stations where there are communication skills, where you have to communicate. Then performing procedures, CPR. Now there's no point, this is a skill. So in a skill, if you go and just study how to do CPR, you know 100%. If someone asks you how to do a CPR, you can explain. But if you're given a mannequin and asked to do it, you do not know how to do it. So it's a skill. A skill comes through only practice, right? Of course, to do the skill, you need the background knowledge. But the background knowledge alone is not going to ensure that you know how to do the skill. It is, it's like swimming. It's like cycling. You can study everything about swimming, but if you're thrown into the water, can you swim? You can't unless you have practice. So a skill is something that you have to practice. That is what I told you initially. Application of knowledge is a skill. So unless you practice, you're not going to get there. Binura?
Yes, sir.
I'm exceeding time. Is that all right? I will need another 10 minutes.
That is fine, sir. You can continue.
Right. Okay. Right. Then there is, now we talked about MCQs, we talked about SCQs, we talked about OSCEs and OSPs. Then there are dissertation and reports. Now these are pre-specified. So whatever the stream is doing, it will tell you this is how the dissertation should be organized. So there's a specified structure that you need to do it. And you must know what do they examine there, what do they expect of you. One is creativity and originality. The other one is a logical thought process that is demonstrated in the report or in the dissertation. And that what you have done is impactful, that it's made an impact on whatever, whether it's a research, whether it's a family attachment program, whether it's impactful. Avoid plagiarism and replication. What do you mean by plagiarism? It is usually, sometimes it's done inadvertently, where you copy and paste because you see this has been written so very well. I can't write it better than this, so you copy and paste. But that means you're stealing someone else's idea. So to avoid that, you either have to write it in your own words, or you have to cite the source. So if you are taking something, you have to say this is from this reference, right? So avoid plagiarism because that is like stealing someone else's work. Replication is now, like I said, a dissertation, a report, some project is looking for originality. So if someone has done, some study and you want to do the same study, knowledge, attitude, and practices of stigmata of epilepsy. If that has been done before and you again want to do the same thing, that lacks originality or creativity, and that is not what is being looked for. So do not replicate. So know exactly what the dissertation or report is expecting from you. That way you perform well. And remember, dissertation reports are just like a question paper. At the end of the paper, the supervisor will say, stop work now, hand in your answers. And similarly with dissertation reports, there is a deadline. 4 p.m. on this particular day, you need to hand it. You can't say, I'm sorry, I haven't finished this. You are not going to do that with the exam paper. So dissertation and reports are no different. And be thorough with the content. Whatever content you write down in that report, you need to be thorough. So that is why if it's your own words, if it's not plagiarized, then you're thorough with the content. And if you have done it yourself and not got someone else to do it for you. Of course, this will be tested with a viva at the end of the dissertation or the report. So now when you go to the viva, you must know what is in the report. So you must be thorough with it. And the second thing is, obviously, to be very well prepared, you must generate the possible questions. If they ask me, what was the method you used? What are the pros and cons of it? What were your inclusion, exclusion criteria? What was the statistical method you used and why? So you are generating questions and answers, so you will be well prepared for the viva. Then there is the viva voice. Vivas always, there is greater emphasis on application than theory recited. You must always understand the question being asked. Do not go with a pre-planned answer. Because often at vivas, we see this. Now we ask the student, there is a patient admitted to the ward with breathlessness. Tell us how you would manage. And the student starts off saying, I would admit this patient. And we have already told the student we have admitted this patient. So the thing is, the student is not listening to the information that is being given. So understand what the question is being asked. Then now when you say this patient is speaking to you, came walking in, is well, then the student say, I would assess airway breathing circulation. Because that the student has pre-prepared an answer. That is not good enough. That is not practical application. So that is what I say, you need to practice this. Understand the question being asked. Apply knowledge to the situation being presented. So do not come with the pre-prepared answer, but be able to answer the question that has been asked of you. And you can do that only if you have anticipated. So you need to generate questions, possible questions at a Viva and practice for that. Finally, we come to the clinicals. There are two types of clinical short cases and clinical long cases. Now, in the clinical short cases, we test only three things. The examination, physical examination technique. Second, eliciting signs. And thirdly, interpreting the signs. Those are the three components of a short case. Now, there are certain, areas that are essential. Now, for example, eliciting signs. If you miss a crucial sign, for example, a patient coming with a third nerve palsy, and you do not mention the size of the pupil, then you have missed a sign, right? Patient coming with a liver enlargement, you don't detect the liver, you have missed the sign. So you get penalized for that. Similarly, if you make up signs, a patient comes with a mitral regurgitation murmur, you say there is also aortic stenosis murmur, then again you get marked up. So it's very important to have your skills good enough to pick up these signs. So here you can say it's purely skills. And skills, I told you, do not come by studying a book. It is by practicing. Now for the A and B, you have only 5 minutes. So, time flashes right in front of you, very fast. And for C, just interpreting signs, you have only 2.5 minutes. So the short case is only 7.5 minutes. And you have 4 such short cases. So the only secret to that is practice. Don't sit in a ward, I see students sitting around and having a chat or reading a book or studying a book or writing a note. When you're in the ward, there is a patient, you need to practice your clinical skills of eliciting signs. You do that every day. You don't need to practice separately for the exam because you're already skilled to do that. If you do it so many times, it's natural. When you come to the long case, there are 4 components that we look at. Gathering information, that's the history and examination, then interpreting the information to derive a differential diagnosis. Thirdly, planning the plan of management, investigations and treatment and follow-up. And final component is demonstration of knowledge in these 3 components on pathophysiology, interpretation tests, pharmacological basis of treatment, right? So this is basically what we expect you to do every day in the ward by taking a history and examination, formulating a differential diagnosis and writing a management plan. So if you do this day in, day out, every day, the exam is no different to what you're doing every day. So that way you are skilled, right? You have 40 minutes with the patient and 20 minutes with 2 examiners. So sometimes one examiner might go through the 20 minutes, or sometimes we divide time. So 10 minutes, 10 minutes, or sometimes 15 minutes, 5 minutes. So it depends. Presentation skills matter. It's how you present yourself, how you organize your thoughts, and how you give it in a very professional, mature way. Then, being lacking confidence. So come with full of confidence. You can do that if you are prepared adequately. So again, prepare adequately means practice. This is a skill. There is no point in memorizing the questions and the answers, right? Pitfalls. This is the last slide that I want to share with you. Pitfalls in exams. The biggest pitfall is if you do not adapt the preparation and performance strategies appropriate to the assessment. Now, if you are going and studying your clinicals in a library, that means you completely lost the plot, because you think you can memorize question and answers for a clinical scenario. It's not going to work. And if you study knowledge, you just study knowledge, and it's knowledge, say you know everything about heart failure. But when you see a patient, if you cannot elicit that history, if you cannot elicit the physical signs and come to the conclusion of a heart failure, then all that knowledge of heart failure is useless. And then if you have memorized the questions, possible questions and answers in heart failure, still it's useless, because you have not recognized the physical signs in the patient and concluded that it is a heart failure. Right? So these are pitfalls in not recognizing that first picture I showed you, not recognizing that you need to bridge the gap between theory and application. When you come for the final, it is about application. Obviously, to apply, you need to have knowledge, and that is what you have been doing all the formative years. You are gathering information, gathering knowledge. And as you are doing that, you don't wait till the last to practice the skill of application. You are doing it at every stage, right? Then this is the most fearsome thing, is being biased by leaked information. Now, during the final exams, students, especially in the hostels, they will come and say, the student who goes before you, you ask, what are the cases you saw? So you say, I saw a patient with a hepatosplenomegaly. What were the questions the examiner asked? That's fair enough to ask, so that you know what are the questions and you prepare with the answers. But of course, there are, students who will come and say, the man with the brown hair and the green sarong had an enlarged liver. Okay. So now that goes into your head, and the next day you go for the exam. And you examine the abdomen the way you have learned, and you find 2 palatable kidneys. And this is a polycystic kidney disease. But the examiner asks you, so what have you found? And the human brain is such that you can't get away from that, because you are seeing now a green sarong in the man, and you're seeing his hair is brown. So you say, he has hepatomegaly, even though you have found the 2 kidneys, because that is the human mind. It gets biased by information. Right? So that sort of information, keep away from. Keep your eyes and ears closed from that, because that will bias 5 years of training. And then you're going to completely lose it, because someone is trying to leak you what patient has what. And you don't even know whether that person, the previous one telling you this person has a hepatomegaly, whether he has actually missed the palatable kidneys, whereas which you have found. And he has thought that the kidney is actually the liver. Because at the exam, no one tells you what the correct answer is. So no one knows what the case is. Okay. So these are pitfalls that you need to avoid. So that's the end of the lecture talk on preparing for exams. So of course, you can't dissociate that from study methods. So that is why I have given you effective study methods that will be useful for your exam. So in summary, I have a little 5-minute video that I would like to share with you that have many of these things that I have already told you in a cartoon.
Our brain can potentially memorize 2.5 petabytes of information, which is roughly the equivalent of 3 million hours of YouTube videos. In order to use some of that staggering capacity a little more effectively when you learn, here are some tips that are based on widely accepted research by neuroscientists and learning experts. Spaced repetition. To maximize your learning, study short but often. Neuroscientists proved that synapses, the million billion connectors in your brain that make you remember and understand stuff, grow mainly at night when you were asleep. This means that it is more productive to study regularly with sleeping breaks in between. Try it. Practice something for 15 minutes every day and you'll be surprised by your progress within just weeks. Find your own style. While listening to the history teacher, Tom scribbles images and Jane finishes 1 kilo of nuts. Some enjoy watching videos over reading books, others study with friends, and some like sitting in silence among a million books. Everybody is different. Good night's sleep. Sleep and dreams are vital to processing and storing new information. A Harvard study showed that students who had a good night's sleep remembered their study materials 35% better than those who studied in the morning to take a test in the evening. Focus. If you tend to procrastinate, which means that you tend to switch from doing something hard like studying maths to something easy like browsing the web, protect yourself from distraction. One way of doing this is to shut down your mobile phone or go to a quiet place like a library. Pomodoro technique. Set a timer to 25 minutes when you focus entirely on your studies. When the timer rings, relax for 5 minutes. If you want to continue, just set the timer again. The small breaks in between are relaxing and motivating to keep going. Hard stuff first. Do the things that are difficult first, because if you are like most people, you have the strongest willpower in the morning. Once you are done with the hard stuff, you will feel better for the rest of the day and probably more motivated to get other things done. Exercise, meditate, and converse. There are few activities proven to grow your brain. However, physical exercise, regular meditation, and good conversations apparently do exactly that. They lead to the creation of new neurons inside your brain and therefore grow its potential. Go places. You can create deeper memories of a subject by learning in a richer environment that offers more visual clues. In an experiment, 2 groups of students had to remember random words. One group changed the classroom while studying. The other didn't. The group that studied in 2 different rooms, one was small and windowless, the other big and bright, was 40% more likely to recall the words later. Take fun seriously. Whatever it is, find a fun way to practice. Modern learning science believes that positive emotions are very important for increasing your learning potential. So do yourself a favor and have a good time. Space your studies. In order to remember things for a longer time, repeat the material in spaced intervals. Facts or vocabularies, for example, are best learned if you review them the first time 1 to 2 days after the initial study, and then again after 1 week and after 1 month. 30% read, 70% recite. If you have 1 hour to learn to recite a poem or prepare for a speech, spend 20 minutes of the time on studying the text and 40 minutes on practicing to recite. This ratio usually leads to the best results. In the case of an emergency, put a glass of water next to you. Take a sip whenever you lose it. Instant self-test. After you study, finish up with a quick quiz. Immediate recall in the form of a test or a short summary on what you've just learned can increase retention by as much as 30%. Because it's much harder for your brain to reflect than to read, that extra effort creates deeper traces in your memory. Don't force it. Motivation is like hunger. You cannot force yourself to be motivated, just like you can't tell someone else to be hungry. So if you are not hungry right now, don't worry. Take a break and do something else.
Okay, I'm done.
Okay, I would like to thank Prof. Tershi Chang for that extremely insightful talk. I think we gathered several useful tips on how to ace our exams. So now we would now be moving on to the Q&A session. So as mentioned previously, we request our participants to send in their questions via the chat function. So you may direct your questions to everyone, or you can direct it to the hosts directly. And we would also like to remind the participants that the recording of today's session will be available on the official YouTube channel of the Rotaract Club as well. And we would also like to remind you all to complete the Google form, which is actually a quiz on what was taught today. And it is essential to complete this quiz in order to receive the certificate of participation, which will be provided at the end of all the sessions of the undergrad. So we will now take your questions. Sir, we have already received 2 questions. So I will summarize the first question. So a lot of us have moved from physical notes to various note-taking apps on our tablets. So this person wants to know whether these electronic notes are as effective as pen and paper. So, but that is basically the question. So what are your thoughts on that, sir?
And very interesting, because there have been a lot of studies on this, looking at people's retention of memory based on whether they write down or whether they just read text. I suppose we are moving into a paperless era, so most students will be using tabs. It is all right if you write with a pen on the tab, but most important thing is make your own notes on a note. Now, for example, now during my lectures, I share my slides. So on that slide, you can always write your notes down, because my notes are my notes, right? The lecture slides, but your notes are your own notes. And students would remember their own notes. And when you're writing down notes, often you have to take in information, synthesize that, and then write that down on the whatever, whether it's the tab or the piece of paper. So it doesn't matter whether you write it on a piece of paper with a pen and paper, or whether you use a tab pen and write it on the tab, it doesn't matter. But make sure that you make whatever note that you take, whether it's you download an article from a source from a journal, make notes on that. Highlight it, make notes on that, make it yours. So when you make notes, don't just make notes, make it with understanding. You understand and you write it down. So that way you are likely to retain it better. So it doesn't matter whether you use a pen or whether you use a tab. It doesn't matter as long as you are active. It's called active learning rather than passive learning. You are actively learning something. So you're taking in information, synthesizing, and then putting it down. So that way you will retain it better.
Thank you, sir. We have another question. The question reads, sir, can you tell us any tips on how to handle exam stress on the day before the exam?
Yeah, again, it's very unique to each individual. So how do you, the most important thing in reducing exam stress is actually planning it out. So I see, that's what I told you. When I come in the morning towards the exam hall, I see all these students studying last minute. That really tells me that these students are not prepared. Or these are the last minute crammers. The first pitfall I told you, cramming the day before, cramming a week before to get through an exam, which means they have lost sight of the bigger picture. So the first thing is, don't leave it for the last moment. You finish it well in advance. Then to relax, certain people use different methods to relax and reduce stress. Some people going to places of religious worship actually will calm you down, because those surroundings are very tranquil and serene. So when you go into, now I go to a temple before the exam. I spend my evening in the temple. I feel very calm and very serene. So the next day morning when I wake up for the exam, so I'm good to go. I'm not stressed, because it's a confidence boost also, because you have finished your study. You say finish because it will never finish. Because every time you study one chunk, you think you have forgotten the rest. But in reality, you have not forgotten it. Just that it becomes a bit more dull. But if you have revised it, you know it. It's there somewhere in your brain, right? But you need to boost your confidence and tell yourself you have actually done it. So it is there and it will come out when you need. So the day before, if different people do different things. Some people, may listen to music to feel calm. Some people might go to a religious place. That's what I do. I go to a temple. I feel quite, relaxed and tranquil with that surrounding, because that surrounding is infectious. And I feel confident. So I think that is the way to reduce stress before the exam.
Thank you, sir. It appears that we have another question. So I will just read the question. So on most days, we tend to sleep for only 4.5 or 5 hours because of a lot of work. Is it a must to sleep for at least 6 hours, even though even though with the work, it is only possible to sleep for 4.5 hours. So that is the question.
There are two aspects there. One is, if it's work that is preventing you from sleeping, that means you're not managing your time well, right? So if you manage your time well, you should be able to find time to sleep. Secondly, is like I showed you, and also in that animation that you saw, which I reproduced here, is because I endorse that, is because your memories are formed during sleep, because we are deluding ourselves, because we study into the night. We don't sleep, we sleep 4 hours, and then we study and we think we have studied, but that memory doesn't store adequately. Memories are formed during your sleep. And I personally would think 6 hours sleep is essential, right? Some people need more. I remember one of my batchmates, he just couldn't sleep less than 8 hours. He said, whatever happens, I sleep 8 hours. And that was true, because we were in the hostel and he slept 8 hours before the final exam or any exam. And he managed his time and he did the exam very well. So, I mean, basically, I sleep at 6 hours. For me, 6 hours is adequate. But it's on each individual, because some students will require more hours. That is, they are used to that. Some will sleep 6 hours. But I think a minimum of 6 hours is a must, because you are fooling yourself if you think, I need to work more and I have worked more, because you are not making optimum use of that. So 6 hours, I think, is almost, I think it's essential that you sleep. And if you manage your time well, you should be able to sleep that 6 hours.
Okay, thank you, sir. So we have a few more questions. So we will take just 2 more questions, because we have already exceeded our time today. And before we go on to the questions again, we would like to remind all the participants to complete the quiz, which is available in the form of a Google form. The link is available on the chat box. And it is essential to complete this quiz in order to be eligible for the certificate of participation. So, sir, our next question is yes, sir, can you tell us a few tips on how to stay concentrated and stick to the study routine with all of the distractions and workload? So if you could highlight just a few techniques, although I think we've already covered that in the session as well, but maybe we could just, go through.
Yeah, distractions meaning you mean the social media?
The participant hasn't specified, sir, but I assume that is what they are referring to, yes.
Yeah, social media, fortunately, when we were students, there was no social media, so we were fortunate that way. But even now, we do a lot of work now. At the moment, we still, live that life, so that I still sleep only 6 hours or less sleep, usually after 12, maybe 1 o'clock, and then wake up at 6. So that's the amount of work we do. But, social media, you need to be disciplined. What I personally do is I don't switch on my internet until, late in the night. Once I finish my work, that's when I switch on my internet. In between, I may switch on the internet for some essential thing, to look at an email, which is official work. But I shall not spend time. I'm not a Facebook person, so I don't waste time on Facebook. I think it's a total waste of time. And even other social media, you have to be disciplined. So you have to because we are all adults, right? Although we call you students, you all are not students, you all are adults. This is adult education. So you have to have the willpower. There are apps to see whether you're addicted to social media. So if you go on to one of those apps and then you find that you're addicted, in that case, of course, you need professional help. But if you're not addicted, then you need to be disciplined. Discipline meaning is that you switch on your internet only after you have finished your work for the day. And that also for a limited time during the day. Because otherwise, whilst you're studying, every moment your phone or your device goes bleep bleep or teet teet, then you are tempted to look at it. But if your internet is switched off on your phone, your mobile data is switched off, your Wi-Fi is switched on, it's not going to make any noises or distract you. So I think that is the way forward. Because what you need to know is, you see, different eras in our life have different objectives. When we were in school, there were, one set of objectives. When we are in university, you're here, there for 3, in medical curriculum, 5 years, other curricula is shorter. But that there is an objective there. You look at it, you are there for a certain purpose. And you need to give that priority. That doesn't mean you're a, completely nerd that you study all the time. No, we had excellent fun. That's why in that video, when you're having fun, you really have fun. You enjoy yourself, you enjoy yourself. You have to have that balance, life balance. If you don't have that balance, then it doesn't have. So exercising, recreation, hobbies, you must do parallel. But always your priority is to do your best at this undergraduate course that you have selected to do. So that is your priority. So don't get your priorities mixed up, but you enjoy life as you go along. You have fun now. All the things that we look at our undergraduate course, we remember all the fun times we had, because there were a lot of fun times. But at the same time, when we worked hard. When we had fun hard. So that's how you do it. So I think social distractions are something that you need to limit, be disciplined, and discipline yourself. But of course, there are students who are addicted. Not only students, there are many people who are addicted to devices and social media. There are apps to look at. Whether you are addicted, if you're addicted, then you need to get professional help.
Thank you, sir. So we will now take the last question for today. Sir, the question reads, Sir, there are lots of notes, lecture notes, word round notes, and also textbooks. Sir, could you please give us a few tips on how we could effectively make our own notes? So, yes, this is a question, sir.
Right. There are many ways. One thing is, as you go along in the ward, when you see, you obviously need to identify the core areas. Once you identify certain core areas, then you organize every note you can make a short note, right? There's no point in replicating notes, no point writing down, copying what is in a textbook, right? So, but you must have little prompts. So what we call a short note. So you have a prompt. For example, if you take dengue fever. So in dengue fever, you will first find out about the microbiology, the presentation, not the microbiology, the epidemiology, the presentation, how would you investigate, and you conclude a diagnosis, right? Then what is the treatment? And then the treatment protocols, because this is something you need to know. You need to know in extent the fluid management that you learn from the ward, right? And you write a little prompt. This is what you do for the fluid management. So these are short notes. And what are the complications and how you manage the complication. So similarly, parallel to that, you will write a patient presenting with fever. Where does dengue fever come into the differential diagnosis? When would you consider dengue fever as a differential diagnosis? So each one will have their unique method of making these notes. That is one way. Some students, what they do is, so that is making a short. Some students, what they do is they use already prepared note. So say the lecture notes. And on the lecture notes, you write the important points. Points that you learn from other sources. For example, if you have read another textbook, say you have the lecture note, you have read the Kumankla, you find something very important there. You understand that and you write it there. What I do is I use different colored pen, or I write I know the source. So I know if I write in a red pen, that is coming from the Kumankla. If I write something in blue, I know it's coming from the Davidson. So I have a color code. Or you can, make a, in parentheses, you can write KC. So, it's Kumankla, right? If it's from a lecture or lecturer has told you on a word round, then you put WR, word round. So you know the source, and you know you're enriched whatever lecture note you have. So you can have a starting point where you can write your own note, or you can take a photocopy of the textbook itself, where you can take the page and add on to that. Because it's not practical to carry a textbook around, and there is a lot of redundant material there. What you have to know is what you need. So my advice is get a good lecture note, and to that lecture note you add something. Now, for example, I have given a study guide in neurology and neurosurgery, which we give during the neurology module. Now that can be used as to add on your own notes, your own words. Similarly, in the medicine clinical professorial, we give a book, a student workbook and portfolio. It's already printed, it's already there, there's information there, and you add your information to that. And into that, you can add, sheets of A4 if you want. And this similar technique you can do on a tab, on a software, or on your computer if you want to do that. That would be much more easier to just write in things. I hope that clarifies. But each one has their own individual style of doing things.
Thank you, sir. So that brings us to the end of today's masterclass on how to ace your exams. So once again, I would like to thank Prof. Tershi Chang for the extremely insightful session. It has been very valuable to us as undergraduates. And we would again like to remind our participants regarding the quiz. So we hope that you have all filled it. And we would like to thank you all for joining us this evening for this session. And we hope that you will join our fourth and final session on time management, which will be the last session which we will be featuring under the undergrad. So once again, thank you all for joining us, and thank you, Prof. Chang, for being here today. And till then, yes, and thank you, sir. So we hope that you will all continue to study smart and have a pleasant evening. Good night and stay safe.
Good night.
Recording stopped.